Dr. Armin Feldman back for the second video in our 3-video series. As I mentioned yesterday, we work with a select group of attorneys who seek us out, want to really know the medicine in their cases, and want to max out their settlement amounts. Today, let's discuss the particulars of a comprehensive medical summary report. Medical summary reports are just that, a complete review of the case and all the associated medical problems, including our medical opinions based on our review of the records, our interview with your client, and our review of the pertinent medical literature. The reports can be used to help do the medical coordination on the case. However, far and away, the reason attorneys have us prepare medical summary reports is to include the report as part of the settlement demand letter. Now, it's extremely unlikely attorneys have a physician writing a comprehensive medical summary report. In fact, it's likely I was the first physician to offer this service to attorneys over 16 years ago. So, in the settlement letter, our attorney clients will write a section on damages and in addition have our medical summary report concerning the medical damages including our medical opinions in the settlement demand letter as well. Now, here are the headings of each section of the report. First, there's an introduction. Then, all the records that we've reviewed with dates. A brief history of events. That's followed by pertinent verbatim records. Next is ongoing medical problems, and that's where we talk about the medical damages. Next is medical costs to date. That's followed by a discussion of the case where we put all of our opinions regarding the injuries. That's followed by future medical care and costs. And finally, there is a brief summary. I want to emphasize some of the critical things we cover. Now, we always talk about and give our medical opinions concerning every injury caused by the accident, including diagnosis, symptoms, and so forth. As well, we always discuss mechanism of injury, causation, and functional losses. We always back up our opinions with evidence from peer-reviewed medical literature. Now, let me very briefly discuss our client interview that's done right after we read all the medical records. This interview is an essential part of writing a complete, comprehensive, and accurate report. We do these interviews by phone or by Zoom meeting, or rarely we'll do them in person in our attorney-client's conference room. We want to clarify the medical records and get any past medical history we feel will be relevant to the arguments in the case. It also gives us the ability to be up to date about symptoms and other issues. As well, in our reports, then we can write the client reports, the client states, and so forth. Finally, it's not uncommon for us to find a condition not in the medical records through our interview process. Often these things are elucidated. We also understand a great medical report must always include our opinions regarding mechanism of action of injury and a causation opinion. These kinds of opinions are almost always absent from treating doctor notes and reports, yet essential in maximizing settlement amounts. By the way, some of you may be aware of the work of Freeman and his group. outlining a valid method of determining traumatic causation of injuries, we rely heavily on these medical journal papers. Now, if you would like to see a sample redacted report, let us know in the message area below this video. Finally, please drop us a comment below and let us know if you enjoyed this video, and certainly feel free to ask us a question or let us know if you have a case for us to review.